everyone. Welcome to the February edition of Chat with a Professional, a segment of Oral Health Africa Initiative's Health Series. At OHAI, we are committed to bridging the gap between health professionals and the public, really, by creating conversations that are practical, that are relatable, and evidence-based. So today's theme is one that is experienced by a whole lot of people, but not so many people are comfortable with talking about it. So we have oral health and relationships, bad breath, gum disease, and the conversations we all avoid. So we all know oral health is not just about the teeth. It affects confidence, it affects communication, and in many cases, it affects relationship, whether it is friendship relationship, marriage relationship, dating relationship, even professional relationship in professional setting. Today we have two outstanding professionals that will be joining today's session. I have with me Dr. Comfort and I have Mr. Mark. Dr. Comfort is a scientist and oral health advocate. She's the founder of Preventive, a digital health education platform focused on bridging gaps in oral health by promoting positive health attitudes. She earned a dental degree from the University of Medical Sciences and she's currently completing her housemanship training at the Federal Medical Center, Abeokuta, where she was recognized as the most reliable dental house officer. We are so honored to have you on the show, Dr. Comfort. Thank you so much for coming on board. Also, we have Mr. Mark, a dental health therapist who has a strong passion for healthcare transformation through research, innovation, and community-driven solutions. His work spanned from clinical care to public health education, outreach interventions, and health policy research. He's also very deeply committed to health advocacy and mentoring. Thank you so much, our dental health therapist, Mr. Mark, for joining us. It's such a pleasure to have you on the show today.
Thank you.
Thank you. So I'll start with this question. What role do you think oral health plays in a relationship?
All right. Thank you for that question. And Dr. Comfort, good afternoon.
Yes, sir.
Oral health is a very significant role when it comes to communication, when it comes to self-esteem, when it comes to how we present ourselves. So, and all of these things they are major factors in the relationship in any form, whether emotional relationship or professional relationship. And so if all of these things are affected, if there's a problem with them, definitely there's going to be a problem with the relationship we are holding with everybody. So yes, oral health plays a very significant role when it comes to relationship.
Okay, thank you so much for that. So you mentioned professional relationship and even other forms of relationship. So do you think oral health issues are deal breakers in a relationship?
I would say yes. I would say yes.
Please walk us through that.
Well, I was speaking somewhere maybe like 2 weeks or a week ago. I was citing an example. One experience I had in the clinic. There's this family, a couple. They were having problems living in the same house, and for about 6 months they were not. The home was not going very well until they had to call family meeting here and there. And when they started asking questions, what is the problem? What happened? The core and the central problem was because the man himself had mouth odor. So unfortunately, the wife did not even tell him, and maybe he's not aware. I don't know, but that was actually the main cause of the problem of the family. That's making it even getting closer to them thinking about breaking up and all of that until they came to the clinic and the husband got the care that was due to him and everything was settled. So yes, it's actually a deal breaker, so to say.
Okay. That's amazing, and I'm so glad that the husband got the care he needed, because a lot of people have gone through this and they've not been able to even decipher the cause of the problem, not to talk of even being able to get it sorted, right? So I'm so glad they did. Yes, thank you so much for that perspective, Mr. Mark. So Comfort, I would begin with you. From a clinical standpoint, how common are bad breath and gum disease among adults, and what do you think are the major causes of that?
Okay, so when we want to speak about how common bad breath is or gum disease, I'll say that clinically we see more gum disease. Now, this is not to say that people with bad breath do not present to the hospital, or most of the times, because the person that has bad breath does not actually know that they have bad breath most of the time until someone actually tells them. So in those occasions, we see those kind of patients come. But definitely gum disease, those that present to the hospital are the number of people that I'm sure are at home that probably have gum disease that not present to the hospital. So yeah, gum disease common, then halitosis relatively too common.
All right, thank you so much. What are the prevailing causes of gum disease or bad breath?
Okay, so particularly for gum disease, the main cause is usually poor oral hygiene. Because when there's poor oral hygiene, there is more room for microorganisms to act. And when microorganisms are present and, they begin to do their microbial activity in the mouth, they start to break down the components of the periodontium. Now, when you are saying gum disease, like gum is just one out of the whole periodontium. Like when we're talking about periodontium, there are 4 parts. There is the gum, there is the periodontal ligament, there is the cementum, and then there is the alveolar bone. Particularly for gum disease, this is still like one of the basic kind of disease when it comes to the periodontium. And so when there is poor oral hygiene, there is no microorganisms to act. There can be inflammation of the gums. So little by little, it might just start as in gums. And the person still does not, attend to their oral health. It progresses again, becomes periodontitis. Before you know it, the bone that is holding the particular tooth, starts to get destroyed. Before you know it again, the person starts to shake. They start to complain that, food particles get stuck between my gums and all sorts like that. So poor oral hygiene particularly is a strong cause for gum disease.
Yes, thank you so much for that perspective, Dr. Comfort, and I'm sure our listeners are following. So, Mr. Mark, I would love to know, from your public health experience, what daily habits do you see that are contributing the most to these conditions?
Well, I think it's important to give this a distinct
Context.
Context. Now,
Please go ahead.
Gum disease is a thing. Halitosis is another thing.
Okay.
Now, yes, they have a place where they connect, because when we start talking about the causes or factors that contribute to halitosis, there's no way we will not mention gum disease. So if we are saying what are the factors that contribute to gum disease, we are also indirectly answering the risk factors that contribute to halitosis.
Halitosis, you're right on point.
So, and just like Dr. Comfort earlier mentioned, the major, or I won't say the only, because we are also talking about halitosis here, but the major cause is bad oral hygiene. You don't brush your food, you don't take care of your teeth, you never visited the clinic before. All of these things all together, they are what we call basic oral hygiene practice. So neglecting them or failing in some parts is something that can trigger a gum disease. And as a resultant effect of gum disease, halitosis comes out of it, plus some other causes.
Okay. So for context, halitosis is the medical name for bad breath. Thank you so much, Mr. Mark. So you mentioned something I just wanted to quickly touch on before we go to the other segment of this conversation. So you mentioned poor hygiene, not brushing often. So is it as often as once a week? Is it as often as once a day? Is it as often as once a month? And you mentioned visiting the dentist as well. So how often should these practices be done ideally? So quickly take us through that. Thank you.
Thank you. So there's always this already outlined principle. Your brushing should be twice a day. Visiting the dentist should be twice a year. You don't need to be in pain. You don't need to have a problem in particular, but you should just make it a routine thing. Brushing twice a day, before bed at night and after your breakfast in the morning. Those are the guidelines. That is the principle for proper oral hygiene practice. You reduce your snacking, just like the first media chat with my wonderful Dr. Blessing.
Dr. Blessing, yes.
She hammered us all of these things very well. The snacking charts, eating food, reducing sugar intake, and all of that. So those are, when we are saying oral hygiene practices, we are not talking something so big or something so special in quotes. But these basic things that we do every day, that we are meant to do every day, your brushing, your reduction of sugar, your snacking, and your coming to the clinic twice a year, just for general examination. So those are what we refer to as the oral hygiene practices.
Thank you so much. And thank you for even referring back to the first edition of this. That's the January edition. So to our viewers, please, the previous edition of this is up on the channel. Please do all to watch it. You would learn so much about how to take care of your oral health in 2026. Thank you so much. In your interaction with patients, Mr. Mark, how does poor oral health affect people's confidence in relationships? So I know that being a dental therapist, you've had to interact with a number of people. So have you seen that poor oral health affects people's confidence in relationship?
Okay, thank you once again. Now, this is a practical thing. If, for example, I'm actually speaking with my colleague. Let's assume we are talking physically, not virtually. Now, and as you asked me this question, I'm trying to answer, and just by opening my mouth to give you the answer to the question you asked, you just covered your nose. No matter how confident I was with the answer I initially have, there's no way my esteem will find a way to escape my body to start with. So these are the things we're talking about. That's at a professional level. Just interacting with people, their gesture of not liking what comes out of you will affect your countenance, will affect the way you feel. And our esteem, our confidence is all around how we feel. It's all about feeling. And once that feeling is affected, we'll definitely withdraw. Now, if we are now talking about let's say couples at home sleeping together, I mean, if someone you don't really know, I mean, someone in public just says that and you feel so down, how much more someone you're living with? And these things they're always difficult to present. There's literally no sweet way to present this oral problem of bad breath or halitosis as it is. There's literally no simple or embracing way to present it. So by that gesture from another person towards you, that shows that you're assuming or you're pushing out something that is not favorable, you definitely feel bad.
You lose your confidence. You lose your confidence. I agree with you, because if not anything, if I have a bad breath and someone acts somehow towards me, best believe my confidence will be dampened to like zero. Really, yes, I 100% agree with you. Thank you so much for that. And yes, so now let's go to the human part of this conversation. We've established that these issues are things that affect our confidence, that affect our day-to-day activities. Dr. Comfort, have you ever encountered cases where untreated like oral conditions begin to affect like the patient's mental and emotional well-being, or even their personal relationships? Have you been presented with such a case before?
Okay, so yes, same cases justice. Now, okay, let me cover so that we overcomplicate for those that will be listening here. So now the thing is, halitosis has like classifications. There is the genuine halitosis, like true halitosis, that can be physiological in the sense that there is no underlying illness. So for example, halitosis is the kind that we call physiological. Now, maybe when you wake up in the morning and you've not brushed in the morning,
and you have a bad breath,
right? That one is a lot of halitosis. There is also like the pathological kind, which means that there's actually an underlying disease. Now, the thing is, the pathological kind can be from an oral cause or from an extraoral cause. By oral cause, I'm saying that, okay, the issue is coming from within the mouth. So for example, we'll be talking about gum disease. So it could be that there is an underlying gum disease, right, that needs to be treated. It can even be that
it's bringing about that.
Yeah. Again, we can talk about the extraoral cause. For example, it might be okay, everything is fine in the mouth, but this person has underlying systemic illnesses. Maybe, for example, diabetes mellitus, right? Diabetes. It could be that the person has gastroesophageal reflux disease. Like this disease have their kind of breath that comes from them. Also, there's even pseudohalitosis, where someone just, tells you that I have bad breath, right? But you
When
as
they
a clinician,
really do not have it.
you as a clinician, you come to examine, but this person actually does not have bad breath. Again, there is alitophobia. Alitophobia people are like, maybe for example, they have had bad breath in the past before. It has actually
They are
been
afraid of it again.
But there is still that, what if it's actually smelling? People can convince such patients, right? It's a lot work. Yes, actually, I've had such cases, and also, like, part of the reasons that people present is because, they are concerned, they are probably anxious, they are probably starting to lose their confidence, not being able to maybe talk in public because maybe somebody's going to sort of retract from them, move backward because you say that they have bad breath. So actually, I've encountered such patients in the clinic. Yeah.
So, Mr. Mark, why do you think people find it hard to tell their significant other, their friends, their partners, their work colleague, as the case may be? Why do they find it hard to tell them about these issues? Like, oh, hello, you have a bad breath. Why do you think people find it hard?
As much as this is a medical thing, it's also a social problem in a way. And like I said earlier, there's usually or literally no fine way to put it, somehow. So, and we as human beings, we kind of take, how do I put it? It's not reports. We kind of have different way we take feedback from people.
I agree with you.
So some persons might feel like, what if I tell this girl now? Or what if I tell this guy? And it picks offense. I mean, there are people like that. So sometimes we just feel like, well, maybe the impact or the possible effect of opening up and telling the person is not worth the relationship. I mean, maybe for professional relationship, and I mean, it's not somebody you're living with. So you just feel like, well, maybe she will know one day, maybe he will know one day, and you just move on. So I think that's one of the reasons why it's kind of difficult. To walk up to the person and just tell them that you are this, you are that. Yeah.
I agree with you. So that's very valid. You're not sure of how the person will take it. What if they get offended and they do not see it in the light with which I'm saying? What if they do not even believe me? I think these are the things that bring about the difficulty in having to tell this person that this is what is happening to you. So, Mr. Mark, thank you so much. So, Dr. Comfort, let's get to the difficult part of the conversation. If someone has a partner and over time you've noticed that they have consistent and persistent bad breath, how do you think they should approach the conversation respectfully?
All right. I believe that we can all agree that communication is one of the important things in relationship. This is bad normally. Everything. Communication is a very important aspect, and
I agree
talking
with you.
about bad breath is something that we can just bring into the conversation when it comes to communication, because now you have identified as this person's partner, as the person that, maybe you are the one there doing like the person you guys are married, or you're on the way to the altar already. This is going to spend the rest of your life, right? You don't want to be forming in the house and maybe holding your breath. Like, how long exactly?
How long do you want to do that? True.
So I would say that to approach that kind of condition, I would say that the person should first of all know the kind of time that you want to bring up that conversation. It's not a time that your partner is stressed. It's not a time that they are well or have a lot just going on in their lives. Like, find a suitable time where you can just bring up that conversation with them. Now, don't go and bring up such conversation where people are like, this thing is like private conversation. So find private time too, like just you guys that are there, where you can bring up conversation with your partner. Another thing too is the manner of approach or manner in which it is said. So it's not like, you come to your partner, you're like,
you have bad breaths. You have bad breaths. Something like that.
I used to shift. Find a way calmly. You can just tell the person, okay, I care about you. I've noticed lately that your breath has been coming off strong. Find a way to sort of package it, and also be resourceful. Be resourceful in the sense that ready with should I say the options of example. Okay, I think we should go to the dental clinic, or I think that if you are aware your partner has not been brushing twice daily, you can first of all start with what do you think? I think that you can start to brush twice daily. Or for example, back to the conversation about going to dental clinic, I won't sort of follow and go with the person to sort of like follow come, so that it's not be like, okay, I leave your partner alone. So you say that if you want to go for dental check, let all of us just go there together. So these are ways that you can actually bring up such conversation with your partner. And I think that we should all have it in mind, right? That we actually, I know it's not easy, that you already process that somebody might find offensive when you tell them that kind of thing. But at the end of the day, we actually have to be real. But in your being real, know how to be nice about it and happy about it. Yes.
Thank you so much for that, Dr. Comfort. Thank you so much. So wrapping up the conversation now, there is something I saw about a week ago, and someone said that if my partner has bad breath or any kind of oral issues, I'll take them on a date to the clinic. And if you were in that shoes, Mr. Mark, how would you convince your partner to follow you on a date to the clinic? How would you convince your partner to follow you on a date to the clinic?
Well, we are talking about partners. I mean, we are emotionally engaged with each other. So
yes,
I don't need to convince you to go to the cinema with me. So I mean, it shouldn't be a big deal if I say, okay, after cinema next week, let's go to the dentist together. It's all part of sharing love and all of that. So I don't think it should be a big deal. What probably makes it a big deal is maybe even the person who should even initiate that conversation do not even know where they should be or what they should do about it. And what to do is something that can come quite easier. We are going together. I'm not sending you there. So it is we. And because we are in relationship, I mean, it's not supposed
going to be easy. Okay, I love that point of view. Thank you so much. So, Dr. Comfort, so if someone tells you that your partner says, Dr. Comfort, no ice cream dates for us today, no cinema dates for us today, our date is at the dental clinic, what would your perspective be about that?
Okay, so personally, this one, let me say, not professional wise, but personally.
Okay, we listen, we don't judge.
I would say that people are different. I feel like personally, if I was the person, I don't think I would want my partner to cut corners, like tell me that this is the issue and this is where we are going.
Okay.
I would not want to cut corners around this. Like I get okay, let's just the same way if someone has body odor, you say, okay, just buy them perfume, don't say anything. You get? I feel like that's also the kind of approach that is being treated in this case, where you just fix a dental clinic date, right? But then, what if it's not just that one visit? That okay, maybe the person has said that it's a professional that tells them, and not the person they are calling their partner, but they must be my partner, and I was supposed to do life together. I feel like I want to go from him that okay, this is what is the issue, right? And let's go to data quick. But then again, people are different. You understand? People are different. What you can take, another person might not be able to get. But at the end of the day, so do what worked for your relationship. That's what I would say.
Hey, do what works for your relationship. So our audience, please, as you go about in your relationship and you might be having oral health challenges or oral problems, please do what works for your relationship. So for Mr. Mark, he said, oh yes, he doesn't mind taking his partner on a date and all of that. And for someone else, it feels, oh, I don't think so. You should be able to tell me so, right? So there are a lot of different things that might work for different people. So we are saying do what works for your partner, right? So we are wrapping up. So Mr. Mark, I'll come back to you. So if you are to give one simple habit, just one simple habit that adults should start doing today to protect their oral health and in the long run protect their relationship, since we've established the fact that oral health has an effect on relationship. So what can they do to protect their oral health and also in the long run protect their relationship? So just one simple habit that we can emulate. So if anybody watches this, they know, okay, I want to take one thing, they can take this one thing. Let's have it.
one simple habit:
Yes.
brush as you should brush. I mean, I'm talking of the frequency now. You're twice a day brushing. That habit alone, well, I wouldn't want to quantify it, but it solves a whole lot of oral problem. I mean, it's not it does not attend to everything absolutely, but that single act, that single practice can, so much help the state of one's oral health.
Okay, I love that. Brushing twice daily. Twice daily. Thank you. So Dr. Comfort, over to you, please. What is that one habit, just one habit you think an adult should emulate to protect their oral health and in the long run, as we've established, protect their relationships?
One habit would be, don't miss your scaling and polishing procedure that is meant to be done twice a year, that is every six months. That's one habit that you actually not joke with.
Okay. Thank you so much for that. Thank you so much for sharing your expertise today. Today's conversation has reminded not just me, but every one of us about the dignity, the confidence, quality of relationships. And we have established that many of these issues are preventable, right? They are manageable. We can treat them, especially when they are addressed early. And another key thing we were able to establish is the fact that avoiding this conversation does not solve the problem, really, right? It doesn't solve the problem. Avoiding this conversation does not solve the problem, but rather education, meeting with professionals, and getting early on dental care does the trick. Yeah. So on behalf of Oral Health Africa Initiative, I say a very big thank you to you, Dr. Comfort and Mr. Mark, for coming on board to share your expertise. Thank you so much for coming on board. We appreciate your presence, and we appreciate the insight that you've given generously into this topic of oral health and relationships. I'm sure that everyone watching now has learned about how oral health can affect their relationships and how they can be better off at it. Yes. And to everyone watching this show today, this is your call to prioritize your oral health. Do you want to schedule that dental visit? Have that conversation. Now, it doesn't have to be disrespectful. That respectful conversation. And remember that when you care for your mouth, you are just not caring for your mouth. You are caring for your whole body in the long run. Thank you so much for joining us on this episode of Chat with a Professional. See you next month.